Welcome back, everybody, to another episode of Sihat Beyond the Clinic. Today, I'm with a very special guest that we have today. Is Dr. Moventhiran Ramakrishnan, a consultant neurosurgeon. A bit of a background of Dr. Muven. He obtained his medical degree from University of Malaysia, Sabah, and later pursued his master's in neurosurgery and is now an expert in complex spine conditions and chronic pain. Apart from his very impressive credentials, Dr. Muven has also an inspiring personal story to share with us today. Welcome, Dr. Muven.
Thank you so much.
Would you like to introduce yourself first?
Hi, everybody. My name is Dr. Moventhiran Ramakrishnan, consultant neurosurgeon that does most of the work with the brain and also spine.
All right. Thank you, Dr. Muven. So, many people know you today as a neurosurgeon, but what's your journey to be a neurosurgeon? Can you tell us a little bit about how it all started, including your upbringing in Kuala Kedah? I say you're from Kuala Kedah, right?
Yeah, I'm from Kedah.
All right.
I'm a Kuala Kedah boy, a kampung boy.
All right.
So it started as a kampung boy with a big dream.
All right.
Kampung boy with nothing and able to achieve something today, I hope. I think I achieved something.
Yeah.
So started my journey because of my background is because I came from very poor family. So my father was a lorry driver, my mom was a hospital cleaner and maid, and subsequently we struggled through. I studied in primary and secondary in Kedah. Subsequently, I pursued my master's until I pursued my master's in neurosurgery and my fellowship in pain and spine. The journey was not easy, but the journey was very long because it started. We have nothing from nothing. So I'm not a privileged kid to have a lot of things being given to you. I think you read in newspaper. Yeah, I studied under street light, which is a true story because that not every day I study under street light, but there are days that we can't afford to buy to pay the electric bill, and I will be under the street light to study. And I worked multiple jobs, and during my primary and mostly in secondary. And then somehow I landed in the profession of neurosurgeon. Yeah.
So what you mentioned that your upbringing was tough with the financial difficulties. How was the support from your parents? Did they continue to?
Of course, I think my parents always support my journey. But only thing, because they are not well educated, so they don't know what you are doing. But the only thing they told you is to be a good human, like to be a good human being, to serve the people or to help the people. So that time they never set a dream that I must be a doctor. And they say, you can be anyone, but as long as you help people. So they support the journey. And then of course, financially, they always say, I don't have support. I don't have a financial to support you, but we can give whatever, we can try to give whatever you want to do. But my father's word always, that I think I mentioned this so many times, education changes your life. You want to come out from the circle of poverty, of course you have to educate yourself. You have to come out through education. There are no other way for you to come out from this education. Change your status. That's what moves.
So he saw the value of education and he instilled that it is important to...
Of course, I think value of education is very important. Very important. It's not just because you are someone, but it shapes you. Who are you? The way you think, the way you behave, the way you are in social presence. So I think you can be rich, but if you don't have proper education, the way you behave, the way you think is mostly, I feel, is different. So like if you're educated, if you are like earning, the whole perspective, I think it's changed the class of the human being. There's an education, change your class, come out from a circle of poverty mostly. This is my personal opinion, which is I think most of us agree on it.
And going through that journey, obviously I think you have a very good resilience. Were there instances where you felt that you mentioned that there was no light to study in, and you said, maybe I don't have to study tonight. But what kept you going on?
I kept going because I want to change my life. You see, I want to change my future. It's always, I didn't do this for anyone. I see a boy, I dream a boy who achieves something. And so maybe that time I never dreamt that I'm going to be one of the top consultant neurosurgeons. But that time I was thinking, I need to be someone. So I think I continuously study. I think I never stopped studying. And until today, I'm still studying.
Yeah.
Until today, I'm still collecting my fellowships.
Yeah.
So I think the spirit is still there.
Yeah.
But I think that's what keep me going daily. And until today, what's keep me going, keep saving a lot of lives. That's what keep me going.
You think that the more you learn, the more you actually don't know about things?
That's of course. I think knowledge is very as big as an ocean. You know?
Yeah.
So the more you dive, the more new thing you learn. But even in neurosurgery itself, because there are so many subspecialties that we want to do. Until today, I still go out to other countries to learn but new technique, new approaches. You're still learning. And I said there are no any barrier or stop for this journey of knowledge. So keep learning, keep studying. You'll be somebody. Equip yourself. Like myself, I will equip myself nowadays to save a lot of lives.
Yeah, and you mentioned just now, growing up, you had to work as a child. I'm not sure how old you were, but you already started working. Would you mind to share that?
All right, I started working from 12 years old. Like, sometimes when towards you always want to buy a new uniform,
Right.
school stationery. So 12 years old, I start as a dishwasher with my mom. 13, I start working as a laborer, and also 14, still with the besi buruk, collecting all the old metals and selling them back. And after that, 15, 16, you're still working in the rice mill factories, pushing the rice on the lorry and everything. So I think I worked throughout. I never stopped working on the school holidays. Every time you have school holidays, I will try to do something to earn something. Because I don't want to be burdened for my parents to buy a new book, some uniform. Sometimes you want to buy a new bag, so you have to work extra to get a new bag. So I think I always try to get things for myself, with working myself without being a burden for my parents.
Without burdening your parents. So you didn't have to ask.
I didn't need to ask. I mean, I don't want to ask, because if I ask, of course, they will try to give me, but I know they will have to work harder. They have to go beyond something they can do to get that. So sometimes I just try to get myself. If I cannot get, I just keep it quiet and keep it myself. Maybe I can buy an Adidas bag now, which is I was dreaming to buy Adidas bag when I was 13, 14 years old. I never had an Adidas bag. I never had an Adidas football boot. So, and then now I can buy Adidas football boot. So I said, my journey made me that I can buy what I want. Maybe last time, a bit delayed, but I got it.
But as you started working, let's say, hard labor jobs from a young age, how did that shape you as an adult now?
Discipline.
Yeah.
And also you appreciate people who are working hard.
Yeah.
Because my wife called me a workaholic or hardworking because I think I start working like that from a young age. It's not workaholic or it's not hardworking. It's mostly like I feel like I always have the energy to do something. I will do it. And it really disciplined me because you start earning with 2 ringgit 40 cents per hour. So now you're earning 100 times per hour. So the difference made, I can see a lot of difference there. But the basic simple things that I learned from my younger days is discipline. Make sure you do your job fully, then you get paid. Make sure the money that you get is worth the job you done. That's what.
Worth the sweat.
Worth the sweat and that's the proper way. Yeah.
Okay. Growing up, what was your treat that you grew up with? Let's say nowadays kids, at least when I grew up, the treat would be like a trip to McDonald's?
Mine will be a KFC.
KFC, yeah.
I love KFC so much until 17 years old. After SPM, I think I decided to work in KFC as a KFC.
You work there?
Yeah, I work in KFC. When I was 17 years old, KFC All Star. I was there for 3 months. I worked there. Well, I love KFC so much. Till now, I still love KFC. But now because of aging, I need to take care of my health. I do cut down my KFC. But KFC is one of my best treat until today. Even my daughter, I gave her KFC when she can do something good. So
But did it come like very frequent as you were growing?
So the treat to get KFC, you always to get number 1 in the class. And make sure everything is A. So I think I got it every 6 months. Every first semester, second semester.
You scored.
I scored. And then, like I said, somehow I was a bright student and I got it. So my father will bring me, I think snack to it. That. So one of the KFC stories, I think, and another one that, the things we call about pay forward. So in my one of the event that I can still recall today, sometimes when you have that one burger selling for 3 ringgit 20 cents. So I will collect the 3 ringgit 20 cents. And this is one time I collect the 3 ringgit 20 cents. I want to buy that burger. But unfortunately, I didn't calculate the tax and everything. But there are people behind me who paid for me. Help me. And they don't know who am I. I don't know who are them. So, end of the day, I feel that humanity started there. So until today, I still pay people in front of me. I said, never mind, I pay if not enough money. I think that's kind of thing that I grew up and shaped me today.
Is that also what's driven you to become a doctor?
To help people. Because you, at that time, the only one thing you can help people is if you have a lot of money, which is, of course, we don't have. And otherwise, what you can have, what the pay you are expecting to help people is in becoming a doctor. And you can treat a lot of patients, a lot of people, and there's so much of satisfaction like that.
All right, let's move into your expertise. Neurosurgery. Why neurosurgery? How did you get into it?
Neurosurgery. So when brain surgery. Because you're dealing with brain. So when I started my medical career, I wasn't sure what I was going to be. So when I become a medical officer, I was placed in general surgery. But I always wanted to do a squad medicine. So when I was in general surgery, it's a bit hectic, but I feel like, nice. The surgeons are very smart. They are very, they are very good. Their skills are sharp and everything. So I joined neurosurgery as a rotational medical officer with Mr. Adam Adosta Kedah. And when I was working with him, after 3 months, he told me something. Are you interested in neurosurgery? Because you have that criteria to be a neurosurgeon. Then I told him, neurosurgery is tough. I said, long working hours. Long operating hours. We operate about, the hours are very long, 12 to 16, 18. Sometimes we operated 23 hours. So I said, I'm not sure, but let me give a try. Because I said, I might like it. But the journey picks up from there. Then almost about 15 years in neurosurgery. Till now. And we'll go until the last breath. I think it's neurosurgery. And I love the challenges. In neurosurgery, every day is a new day. It's not the same thing you're doing again and again. Every patient is a new patient. Every tumor is a new thing, new adrenaline. You won't feel tired even you're operating 18 hours until you clear the tumors, until you clear the problems. The next day you come back fresh. So I think that's what keeps me going, and that's what I love to do.
Was it hard getting into neurosurgery?
Oh, wow. I will say because limited number of seats, and one of the toughest problem that you cannot get on time. Like example, the exams are tough. Even from the start of the entrance exam, because my batch was only about 14 of us. So the whole seat, about 14 seats, and about 30 to 40 people will apply. And from the screening program itself, we already been cut down. And imagine like I told you, I'm one of the smart students from primary, secondary. I failed my final year exam. Final year exam to pass out as a neurosurgeon. So that moment, I feel what the meaning of failure in exam.
So imagine you are 34 years old, suddenly you fail your exam, you're sitting there. And then one of my teacher or my supervisor called me up and said, you need to learn how to accept your failure. Because most of the neurosurgeons are very smart. So you're always flying high. So sometimes there are setbacks. You need some setbacks for you to, recuperate and learn about it again and come back. But after I failed that 6 months I spent in USN, I think changed me a lot in direction of surgeon. I find become my area of interest. Now I focus on my spine, my pain, and also my complex skull bases. I think sometimes failures are good. So one of the best failure, I think I failed. Only thing I have to be away from my family for 6 months.
In Kelantan. Your family was in?
My wife was in Ampang that time, and my father was in Alabsta. So I think a lot of sacrifice actually.
Yeah. So that 6 months that you spent, you're no stranger to perseverance.
Yes.
But how did you see it differently? Like, did you feel like a failure at the time?
I never feel like a failure. I feel like there's always a reason why you fail your exam or you fail that time.
Yeah.
So how I want to be better. So I took a time. It took about a week to come up from that trauma. But after that, there are a lot of people motivate you. They say, hey, Muven, it's okay. It's okay to fail your exam. It's okay for you to go through one-time failure, but you will come better. And I studied more harder and harder. I think at 34 years old, my whole room full of notes. I think I posted my social media.
Yeah.
Everybody said, you're crazy. But yeah, because I want to pass the exam.
Yeah.
I study harder. I understand the disease harder. And I think I remember most of the thing. And I went for exam more prepared and passed. I passed. And I think I got a good result in my second attempt.
How do you think is different, your journey to become a neurosurgeon compared to now? Because we're seeing like it's difficult, very competitive to get into a training pathway. And how do you think doctors now can get into the program as compared to what you went through?
So I think they need to ready for, first of all, when we look at the system itself. So I think because they are in the contract system compared to us who are permanent system, that's very much different in the first line basis. And they need to understand doctors is not 8 to 5 4.
Yeah.
It's not like you have to come to work at 8 o'clock and you go back at 5 o'clock. If you do like 5 to 7 o'clock, you're going to get paid extra. There are no overtime claim that you can get. And like ourselves, if we operate a case from 8 o'clock until the next day, 7 o'clock, or example, 4 o'clock in the morning, we still get the same amount of salary. We never get paid for OTs. We never get paid for the hours that we spend extra. But one thing we take it, we feel like the satisfaction beyond what we did, that hours you spend with the patient operating, that what moves us. But the younger generation, I feel like they start to feel like, oh, why should I overwork? Why should I become, I have to spend a long time. So sometimes you need to sacrifice in some certain point in at work for you to be better. Like example, I sleep in OT before I get into a cover. Like example, in Sabah, when I was in Sabah, I moved myself from Alustar to Sabah just to further my neurosurgery experience. And when I was there, I still remember I was in OT, almost in a month. I was in the pantry. I was staying there to do all the neurosurgery cases to make my surgical skills good. So we spend a lot of time to improve ourselves without pay. Because like money is second, but now I want to be a surgeon. So that's really matter for us.
Perhaps the journey that you went through working since young, made you prepared to curate yourself. Practice makes perfect.
Yeah.
The hours spent.
Yeah, the hours spent, the practice. Sometimes we are winning. Sometimes there will be some things you're not sure. Somebody else like good in it. Then we are willing to go and ask, can you come and teach us how to do it? Sometimes I go to my boss, I'm not sure how to do this. Can you come and teach? Until today, we are not sure. We need extra hand. We call them in, come. Because why?
To help out.
Let's do the best for the patient. Nothing. It's not about ego. It's not like you got nothing to lose in medical if you're trying to give the best for your patient. As long as the patient happy, the life's been saved. For on.
Any memorable experience along your journey as a neurosurgeon, as a doctor?
There are so many. There are so many. I think the most memorable, the days the most nice journey when you took over the patient. Everybody thought he gonna die.
Yeah.
Like everybody said, oh, this is no hope. Then when you walk in, you can see the family like looking at you. Can you do something? So sometimes you say, I can try for you, but this is always a 50-50 situation. But that's what neurosurgery is all about, 50-50. It's like you make it or you don't make it. So whenever you do the surgery and patient goes back home, they start talking, moving. We got surprised, patient got surprised, family got surprised, and they appreciate you. And people do prayers in church with my pictures there. One of the time I saw hey, this is my picture. It's like, the appreciation that you get is something, it's not about the money. It's about how people look at you, how people appreciate you.
You've got passion there.
Yeah, I love that. I love my passion there. I love my passion. I love my job.
Dr. Muven, your mother pushed you with the good results that you had. How did you feel about that? You're like, okay, I'll be a doctor.
I think she never pushed. She said, actually, that one click is actually just to make her satisfied.
Okay.
So because whenever you look through, in the UPU, right, it's very hard for you to get medical. So when I put one option of Dr. Perubatan University Malaysia Sabah, and the rest of it was teaching, was engineering, teaching and engineering, I thought I would get engineering and teaching. But somehow, the luck, the destiny, my mom got the letter from UPU. She saw the letter. She asked my neighbor to read apa yang ditulis in Malay. Said your son got doctor of medicine in medicine. She was so happy. So I was like, okay, all this while she was keeping that she wants me to become a doctor. But she know I never tell her I want to be a doctor. But somehow I say, okay, let's try it. But I told her, maybe I fail in first year. It's it's tough, medical is tough. But Sabah. So you have to go to Sabah, then you have to be there, then you have to do medical, something like you never prepare your brain because you're already preparing for either you gotta do teaching or engineering. But somehow it's end up well. And I start serving in 2011 and now it's 2010 to 2026. Until now, today.
Dr. Muven, medicine is evolving. Now we have robotic surgery, interventional radiology for the brain and all. Neurosurgeons running out of work in the
You cannot replace us.
Yeah.
You cannot replace our brain. You cannot replace our hand. You cannot replace our skills.
The skills,
Because not like I said, every single case is different.
Right.
Our eyes can see what other people cannot see. Maybe AI will say there is a bleeding, but we know what are the methods that we can use to stop the bleeding. AI might say step 1, step 2, step 3, but there is no step 1, step 2, step 3. That is your experience that you're going to stop the bleeding. Maybe it can take over in algorithm of how to manage the disease. But in operating, I think this is the best robot.
The hands.
Yes.
The touch.
The touch, the feeling, and it's usually, I say, it's your eyes, your brain, and your heart. When you touch the brain with your scalpel is most important.
Practice makes perfect.
Of course, that come in the long term hassle, struggle, pain, and dramas.
Was it worth it?
Of course. It's not about the bank account, but look back how many cases you saved. Look back how many people say thank you to you. Look back how many people that waiting to see you in your clinics. That means it's not the bank account at all.
Okay, Dr. Muven. Any last words for aspiring doctors, aspiring surgeons, neurosurgeons, or going through a hardship that for them it's important to persevere from you?
Just be consistent. For the young doctors, be consistent. I think the journey is long for young doctors. Like for me, I still have another 20 years in normal service. I got another long years, 20 years in normal service. If we never understand the process, what you are aiming, what you want to be, and what you want to serve. This is very important for you to understand what you want to do. What is your aim? What you feel when you manage a patient, you save a life. That is the satisfaction. And which is like, maybe you get a better offer in private, but you still can serve the whole country wherever you are. But I will say, always treat your patient like your own parents, because you want to do the best for your parents, and you treat your own patient like your own parents, and you will do the best. Own your case, or like it's like your own case.
Yeah. All right. Thank you, Dr. Muven,
All right.
for this very inspiring session. All right. That was Dr. Muven, consultant neurosurgeon. We hope that you liked this episode. If you liked it, like, share, and subscribe to Sihat Beyond the Clinic. Till next time.
All right. Thank you.
All right. Thank you.